aspirin or nitric oxide, which is better for reducing the risk of blood clots. For a long time, the medical community has recommended a daily baby aspirin to help prevent blood clots that could lead to a stroke or heart attack. That has recently changed. I addressed this issue in 2009 when I asked the question, which is better for reducing the risk of blood clots, aspirin or nitric oxide? Hi, this video is from Dan Hammer Health. And if you find value in it, then please subscribe to my channel. Given the recent change in the medical community, the answer leans towards nitric oxide. While most of the medical community will not acknowledge the benefits of nitric oxide therapy, they have certainly changed their position on the use of aspirin. Quoting from the November 16, 2021 article from the Cleveland Clinic titled "Should You Take Daily Aspirin?" They state the following. For many years, you might have assumed that taking a low dose of daily aspirin was a good way to prevent strokes or heart attacks or protect heart health. Over time, however, multiple studies showed that this habit could cause serious complications, including an increased internal bleeding risk. These risks are now being acknowledged in new recommendations about who should, and shouldn't, take daily aspirin. A link to this article is provided in the description below. Here are the new guidelines, as recommended by the U.S. Preventive Services Task Force. Don't start taking a low dose of aspirin if you've never had any heart-related problems or events, like a stent or heart attack. Don't start taking a low dose of aspirin if you have an increased risk of bleeding. Don't start taking a low dose of aspirin if you're over age 60 and aren't already taking daily aspirin. In 2019, the American College of Cardiology also revised their guidelines. Their new recommendation was to not use daily aspirin if you were over the age of 70, or for any adult who had an increased risk of bleeding. A low-dose aspirin or baby aspirin is usually 81 milligrams. But as the medical community has learned, even at this low level, aspirin can still be a powerful antiplatelet agent, which prevents red blood cells from sticking to each other. This means that aspirin can increase the risk of bleeding, especially internal bleeding. Also, long-term studies have suggested that older adults taking a daily aspirin were at an increased risk for death from any cause, including cancer. So what should you do if you're looking at aspirin to decrease your risk for a stroke or heart attack? Well, first talk to your doctor. And when you do, ask him or her about using nitric oxide therapy to help reduce your risk for strokes and heart attacks. While most of the medical community still does not acknowledge the research in this area, you need to know the following. Your vascular system is lined by endothelial cells. One of their functions is to properly regulate blood clotting. It does this by creating two molecules. One is nitric oxide. Nitric oxide is critical in the proper control of blood pressure. Nitric oxide also inhibits platelet adhesion, activation, secretion and aggregation, as well as promoting platelet disaggregation. This is extremely important in preventing blood clots in the vascular system that can lead to heart attacks and strokes. It is also a critical factor in sickle cell anemia to help prevent red blood cells from changing, adhering to each other, and clinging to the vascular walls. This helps to prevent blockages which cause most of the pain and tissue damage associated with sickle cell anemia. Even though your body uses nitric oxide to prevent blood clotting, it's interesting to note that the endothelial cells are also necessary for blood to clot. They synthesize the vitally important molecule called factor VIII or von Willebrand's factor, which is essential for blood clotting. Without this molecule, a person could bleed to death from a simple scratch. Aspirin is a drug. Because of this, it has the potential for other side effects besides the risk of bleeding. Some of the most common side effects are stomach pain, heartburn, nausea and vomiting. Aspirin is one of the leading causes of gastrointestinal tract complications, which include microbleeding and ulcers. If a person wants to reduce their risk for blood clotting, then the proper repair of, and support for the endothelial cells, is vitally important. Clinical studies have shown that a well-designed L-arginine/nitric oxide protocol can repair the endothelial cells. This allows them to perform one of their primary functions, which is to keep the blood flowing without the danger of blood clotting. If you would like to get more videos on how to improve your health, then please subscribe to my channel. If you have questions or need to contact me, then here is my contact information. Thanks for watching, and please share this video with others. Together, we can make a major difference in the health of our family and friends.